day that we've been planning for. I can report that we have new community cases here on the Gold Coast and a number of incursions. So what I can report today is we have 9 cases and one further one under investigation. One of these is overseas acquired and 2 are interstate acquired, and of those 3 they're all in quarantine. But we do have 6 people on the Gold Coast who have been in the community infectious for a number of days. These 6 people make up 4 different incursions that we can see so far, and there is another one under investigation that could see 5 incursions. Now this is what we're planning for. We said there'd be cases, and this is what we are seeing. We have a male who has been vaccinated with 1 dose, recently moved into the state, who has been infectious for 5 days in the community. We have a female who works in the border zone, and her partner and a child who are all infectious. The child is a student at Broadbeach State School. I understand the school has already taken measures to close today and getting all students tested, and they're isolating at the moment while they get their results, and we're quarantining the class and the close friends of that child. We also have another male who has recently been in Byron Bay and who's infectious. This gentleman plays in a band, and I understand other band members have now transferred over to Western Australia, and we're notifying Western Australia authorities of that now. We have another female who is positive. She is a close contact of the first person I mentioned who moved from interstate, and we have another person under investigation. Those suburbs cover Mermaid Beach, Mermaid Waters, Broadbeach and Mudgera Bar. So we can assume that there is likely to be transmission happening across the Gold Coast. We know that the Gold Coast double dose rate of vaccination is around 4 to 6% lower than the rest of Brisbane. So we need people to come out immediately and get vaccinated. We will have extra testing capacity over the weekend and over the coming days, and the private pathologists have already indicated that they will be allowing people to come in and get tested without referrals. We ask anyone who's coming out to get tested over the next few days, just check online for our sites, because there's likely to be additional sites and also extended hours to make sure anyone who's got any symptoms whatsoever are getting tested. Of course, please look online for exposure sites. This is very early on, so there is likely to be exposure sites as we continue to interview these people throughout the day and coming days. So please, if you are on the Gold Coast now, have been on the Gold Coast for at least the last 8 days, or you have visited the Gold Coast in the last 8 days, we ask for you to be looking at these exposure sites. Please remember that we've had around 10 cases that have been on the Gold Coast in the last month, and we don't know what other transmission could be happening here. So it is so critical people come forward and get tested. I also want to remind people that you need to check in. We've seen a lot of complacency creeping in. You want to know if you've been exposed to someone who has this virus, because that way you can keep yourself safe and your loved ones, especially vulnerable and elderly family members who you are going to be catching up with over Christmas. Families will be coming together to celebrate Christmas, and you want to know if you've been exposed to the virus as quickly as possible. The only way we can let you know quickly is by using your check-in app. So please, it has never been more important. Anywhere in Queensland, use your check-in app. Get tested, get vaccinated. Also, on the Gold Coast, we are strongly recommending people start carrying their masks everywhere with them, and when you are indoors, we're strongly recommending you are wearing your mask when you are on the Gold Coast. This is important because we don't know the level of transmission that is happening here right now. Just as an indication of what we might expect and why we're starting to see these incursions happening, New South Wales has had 63,000 international arrivals since the 1st of November who haven't had to quarantine. And we are seeing New South Wales cases go up. So it is inevitable that these cases are going to move into Queensland when our borders open on Monday. This is going to start moving in quicker. And we're standing at an iconic attraction, a Gold Coast attraction, wet and wild. If you want to support the tourism sector, jobs in our economy, you need to come out and get vaccinated. That's how we can make sure that we're supporting these businesses that are keeping our economy going. And I know that this is one of those attractions that come next Friday, the 17th of December. You will have to be fully vaccinated to come to a place like this, giving people the added level of protection, knowing that everyone here and everyone who's wandering around is fully vaccinated. Last thing I want to say is our healthcare workers do an incredible job. They have worked tirelessly over the last 20 months to keep us safe. But sadly, we are seeing abuse and threats of our health workers in our hospitals, in their workplaces and surrounding areas. This is appalling. It's completely unacceptable. If you know of anyone who is making these threats and abusing health workers, please report it to the authorities. I want full force of law thrown at people who think it's acceptable to threaten our health workers simply because they are vaccinating and keeping our community safe and doing such a great job at it. So I want to thank our health workers once again for the great work they're doing. I will now hand over to Dr. Aiken, who'll go through these cases a little bit more, and then we'll take questions. Thank you.
Thank you, Minister. And as you've heard, 9 new cases today. 3 of those are in hotel quarantine or quarantine arrangements. 2 of those are interstate arrivals who are members of families that already have cases linked to them, and those 2 cases of children who are with their parents with their family currently. The other is an international arrival who is day 1 in hotel quarantine. We will go through the usual process of contact tracing through that flight. The cases of interest are 6. They're all Gold Coast, and there's 1 other person of interest in Gold Coast who has just been notified and working through it at this stage. 3 of those cases belong to a family group. One of the family members, one of the parents, works across the border. This is an interesting point to note here that person developed symptoms, had a rapid antigen test which was negative, but thankfully that person went and had a PCR test the next day. The PCR test was positive, and that's how we detected this person in the case. And just enormous shout out and thanks to that person for having the responsibility to not put the complete trust in a rapid antigen test being negative, but go out the next day and have a PCR test. That means we've been able to identify her partner is positive, and one of their children is positive. That child was tested positive this morning. They're at Broadbeach State School, and we're working with the Department of Education at the moment. Her immediate class and friendship group will be in quarantine. Others will be tested and isolated as casual contacts. That's a really important transition as we start to move forward and accept the great degree of risk as we're opening up Queensland. The other cases of note, there's a male in his 20s who's moved across from New South Wales, has tested positive. We're working through with his housemates and close contacts as well. One of his close contacts has tested positive this morning as well. He's had 1 dose. He's been infectious in the community for 5 days. And I should add that that family of 3, the mother has been infectious in the community for 8 days, the father for 6 days, and then the children for a couple of days as well, 6 in June. There is 1 child that is still tested negative, and we're at Miami State High School. They are negative at this stage, and we're watching that closely with 3 members of that household testing positive. The other cases of note today is there's a male in his 30s who's travelled to Byron. He's fully vaccinated, also works disability work, and we've followed up with people that he's worked with already. There is only 1 person exposed from that. He's been infectious for 3 days. 3 of his band members have travelled to Western Australia. Our public health units have spoken to Western Australia, and I've spoken to Western Australia's Chief Health Officer this morning as well. And they are working and looking at those people. They are close contacts at this stage. And there's also a case that we're working through at the moment, which we've just come in at Mudgee Bar, with no further details on it. The big message here is this is, as the Minister said, this is what we've been ready for, this is what we've been waiting for. In all honesty, I'm surprised we haven't had these cases come through from New South Wales already. That's certainly the Victorian experience. But it's a timely warning that as we open up our borders, we will get more cases come through. We will get more seeding events come through. And it's so important that people go out and get vaccinated. It doesn't matter where you are, if it's Gold Coast or anywhere else in Queensland, because you know that if you're vaccinated, you'll have less severe disease, and that's the real target here. The other things, just for Gold Coast, is please, if you're out and about, we encourage you to still go out and about, but please check in. So if you do go somewhere where a case has been, we can contact trace you, we can be in touch. The other thing, as the Minister has said, is wear masks. If you're in an environment where you can't social distance, I think it's up to you to start thinking about where you want to be and where you want to wear masks. Not just protect yourself, protect your family, and if you do happen to be exposed, and remember in that early infectious period before you develop symptoms, that you don't accidentally pass it on to someone else. The other thing is the ongoing reminder, if you do get symptoms, please come forward and get tested. Do what this woman who's a cross-border worker has done. She's got symptoms, got tested, had a rapid antigen test, but not really been confident, gone out and got a PCR test, and that's the most important thing to do. And the other thing is, finally, and I'll keep saying it, please go out and get vaccinated. It's vaccination that is going to get us through this. We will still get cases, we will still get disease, but vaccination will mean we get mild disease that everyone can live with and cope with. We don't have a hospital system. We reduce the risk of our community members getting sick, going to hospital, going to ICU, potentially dying. On that note, if you haven't already, please get vaccinated. Thank you.
Just very briefly, while it's keen that we obviously are in a good position to celebrate the fact that there are so many people from within Queensland and beyond who want to come here and enjoy a holiday, we know that COVID doesn't take a holiday. So it's important that we continue some very clear and simple messages that we've heard already from the Health Minister and from the Chief Health Officer, and that is, one, check in, continue to check in, follow those health protocols that we all have become so familiar with, and finally, and this is very importantly a message for everyone here on the Gold Coast, is get vaccinated. Getting vaccinated makes a massive difference to how we manage these increasing number of cases that we will see. The higher the proportion of the community that's vaccinated, the more confident we are with the ways in which we can manage this situation. And even those who do catch the virus are a lesser risk of spreading the virus. So therefore, being vaccinated is the most important thing you can do for yourself, for your family, for the broader community, and for the economy, particularly here on the Gold Coast with our very important visitor economy.
So I'll just give an update of our other figures. So with the new cases today, that puts us at 44 active cases. We have had 11,065 tests in the last 24 hours and 11,108 vaccinations. And of course, as we all know, yesterday we hit the 80% double dose. So we now are 87.9% first dose and 80.11% second dose. And congratulations, Queensland, for doing such a great job. You know, who would have thought, just as we hit that 80% double dose, this is when we start getting these incursions happening right here on the Gold Coast. We said the Gold Coast is likely to be the first one to see these cases breaking out because it's so close to the border, and it's a huge wake-up call for the Gold Coast to come out and get vaccinated. But to all Queenslanders, please get vaccinated, get tested and check in.
Minister, it's too late for people on the Gold Coast to get vaccinated, isn't it? They won't be protected.
It's never too late. The number of cases in Queensland is going to go up, not down. The quicker you get vaccinated, the quicker you have protection. It is never too late to get vaccinated. Get vaccinated now because it starts protecting you, and you know that once you get that second dose, beyond you're going to have greater protection. So get vaccinated today. Start that journey now.
What's the condition of those 6 people that you have to cover?
So I understand that a number of them do have symptoms, but they're not unwell.
And do we know if it's Delta or is that where
I don't believe we've got the sequencing of this.
Too early to tell.
Too early.
And anything on that vaccination status?
Yes, so I can close as I say, the first gentleman, he had 1 dose. The female who works in the border is fully vaccinated. Her partner, I will announce this, her partner's had 1 dose, but he went to the vaccination centre and he appears to have been infectious at that time. So that's the Broadbeach Vaccination Centre, and he was infectious while he was there. Their child is in primary school, she's so not eligible to get vaccinated. The other gentleman who's gone to Byron Bay has had 2 doses, and the last one The last female who's in contact with the first case has had 1 dose. So the public health unit will be assessing, how many people need to quarantine and who needs to isolate and get tested until they get the result.
Is it a relief from the Commonwealth this morning that kids of that younger age can now get vaccinated soon?
Oh, absolutely. I know parents have been saying to me, what about my younger children? I'm so worried about my children under the age of 12 because we know that at least with Delta and what we know of Omicron, which is more infectious, is that it is likely to spread through children quickly. And we know that even if they don't get seriously ill, they can pass on to adults and vulnerable people in the community. So it's great news, and we will work to ensure that our pharmacies and our GPs and ourselves are working closely together to make sure that capacity is there for families to come out and get their children vaccinated in the new year.
We'll be ready to go straight away on that.
Yeah, we've certainly got the supply and we will be ready. But we do strongly encourage people to go to their GPs, especially when it comes to young children. I know a lot of families have a lot of trust and confidence in their local GPs, and it makes sense if you're taking a young child to get vaccinated. We want this to be a positive experience. As far as their vaccination, maybe the first vaccination they've had that they can remember, and so it's important to go to their GP or community pharmacy.
So there's enough supply to vaccinate every 5 to 11-year-old child in Queensland?
The Commonwealth are telling us there's sufficient supply to do this, and for boosters.
Any plans to mandate that at all for kids to get to?
Not at this stage.
We're expecting an update on Omicron coming out from the Cabinet today. Who from the Queensland government will be getting up to talk to us about that?
Well, the Premier's made it very clear that it's the Commonwealth who will be providing information about Omicron, and we'll leave it to the Prime Minister and possibly his Health Minister and Chief Health Officer at a Commonwealth level to update all of
Any
this.
changes to Queensland's roadmap at all?
Not at this stage, no.
The Byron
This is
Bay,
what we planned for. We said there'd be cases, and this is what we all need to be ready for.
could that Byron Bay case have been picked up at the Woodies Surf Shack outbreak? Do you know that?
Look, it's just too early to know. Like, literally, these cases have come out through the evening and first thing this morning, so there's a lot of work to do to find out what exposure they've had, whether they're linked to any other cases, and also all of their exposure sites that other people now need to be aware of.
When will you release guidelines for businesses who have close contact?
So a statement was put out yesterday that I'll be doing that very shortly.
Is that before Monday?
It'll be before Monday.
So tomorrow or something?
The next couple of days.
Well,
But
businesses are really keen to know these details.
Of course they are, but as I said the other day, it's really important that we get this right and we make sure that we're doing this in a safe, responsible way, and we're taking the best advice based on what's happening right now in Queensland.
Those plans not being finalised, you're still working on them today.
We are finalising those reports. They are at a completion stage, but remember, we just got up this morning with 9 new cases. We just want to make sure we've got the parameters right, but we will absolutely be letting business know.
Shouldn't this have been
what
worked
those
out earlier for businesses though?
We've got to make sure we're using the most up-to-date health advice.
Are you waiting for National Cabinet advice?
No, we're not waiting for that.
Is the Wildern business venue mandate only like 90%?
I know.
No, it's going to go beyond that.
People should expect that the mandatory vaccination will go on for some time. We said we'd review it, but I've heard rumours people are waiting for it to be lifted at 90%. They shouldn't wait. Get vaccinated.
Will these cases be managed at home or they be taken to hospital?
So I understand a number of them are being managed at home.
With the border opening, when will border passes be available to apply?
So more than likely, we're working through that with the Queensland Police Service. More than likely Sunday. We can't have them go live today or tonight because we can't have people incorrectly downloading the wrong pass. The pass has got to be available at the time that it takes effect. But obviously people need a little bit of time to make sure it's instantaneous. As soon as you can check those boxes, upload your vaccination status and your negative PCR test, you're going to be able to get that pass instantaneously. But because we've already clearly said when this is coming in, 1 a.m. Monday morning, people should already be going out and getting their PCR test and having everything ready to go. So as soon as the system goes live, they can update
Are you
it.
worried the website might crash?
Look, I'm being reassured that it can cope with whatever demands coming its way.
And if people are being tested today but they're not able to get in until Monday afternoon because of traffic delays, and then technically it'll be after 3 days.
That's okay. It'll be within 72 hours of the pass, so that will be okay.
But
We understand.
With the PCR test, if that's expired 3 days, if they can't get tested over the weekend and there's delays getting in, will be the only leeway.
Again, people need to make plans of when they want to come in. You know, if they want to wait till some of the traffic clears and they're not planning on getting on the road till Tuesday or Wednesday, don't get a PCR test today, because that's obviously not within 72 hours. If people plan when they're planning on coming in, you know, the police will manage this in a very sensible way, I'm sure.
Can you clarify about children? What children under 12 months of age, over 12 months of age, who has to get a test, and what exactly the test do they need to do?
Well, look, I understand that the chief officer said that yesterday, but I'll pass over to Dr. to talk about that testing again.
It's all PCR tests, that's probably the important differentiation, and it's not a rapid antigen test. The other part is then children will still need a PCR test. Children under 12 months, a saliva PCR test is acceptable. We've done that work with the Children's Network and making it tolerable and it's within degrees of accuracy.
There are families in New South Wales who are struggling to find clinicians who can actually get those tests. Is that a concern?
Look, I think it's something we work through and continue to work through with our state colleagues and private providers, but the real issue here is just making sure those people do get the PCR test before they come into Queensland, keep the border community safe. It will be a challenge for everybody. There's a challenge for people on the Queensland side of the border as well to make sure they're safe.
Queensland Health is telling us that children over 12 months. When did it become children under 12 months?
Sorry, I'm not sure I understand.
So Queensland Health issued a statement saying it was only people over the age of 12 months of age need to get a PCR test.
The standard PCR test, so the deep nose or oropharyngeal test is over 12 months. Under 12 months, the salivary test and PCR test is safe.
Dr. Rick, Queensland Government has made the virus allow you to return to Queensland in quarantine rules?
No, look, if they're identified and notified that they are at pace while they're interstate, they'll need to stay there. And that's a standard arrangement across all the states. And really that's just about keeping the rest of the community safe. We don't want people moving and travelling through New South Wales to come to Queensland. That's a risk for New South Wales. We don't want people travelling anywhere and spreading the disease. A really key thing is when people are notified, one of the first things we do when we talk to them by phone is to say, and we let them know, stay where you are. Do not go anywhere. You need to isolate. And the same thing applies on the station.
How long will they have to stay there? Because you can actually, quite often you can test positive even when you're not infectious. Do you have to stay there until you test negative?
Look, there's a standard agreement for how you recover from COVID and the conditions that are mapped out in the series of national guidelines. That's normally a series, either 2 negative tests, 1 negative test, absence of symptoms, or can be pre-treated. And that's based on national guidelines. That's how that's performed. It's making sure people aren't infectious to be able to remain.
You said masks are recommended now for people to carry them on the Gold Coast. Should people on the Gold Coast expect further restrictions over the next few days?
Look, at this stage, no. I think what this is about is we know we're opening up, but we're encouraging the community to come with us. We're encouraging the community to act responsibly and sensibly. I'm sure they will. I'm carrying a mask. I've got it in my bag there. But I think everyone probably should. And if you're in environments where you can't socially distance, wear a mask. And I think the community will do that. I'm very confident that they'll be sensible.
Earlier this week,
Recent cases that have actually returned when you test out now, do you know if they came from the classes and then on the Gold Coast?
No, they all appear to be separate, but fired interstate from New South Wales.
Earlier this year we saw COVID spread through schools. There was that schools outbreak. Are you concerned that something like that could happen at theme parks over summer? I mean, there are children everywhere. How are you guys going to mitigate stuff like that?
Well, come the 17th of December, people will be fully vaccinated around here. So
Even children?
children who can be vaccinated, under 16, but if you're over 16, you'll have to be vaccinated.
And so if you're over 16 and you're not vaccinated, you can't come to a theme park? And the same if you're under 16?
Under 16, it's encouraged but not mandatory at this stage because kids haven't had the same opportunity to get vaccinated yet.
How many cases are we expecting? What's the worst case?
Look, there's a lot of modelling done and different modelling is variable. But the big thing from the modelling is that when we continue with that TTIQ and public health and safety measures, we can reduce the case numbers by simple things, by the higher the vaccination rate, the lower the case numbers. The more people wear masks and reduce spread, the lower the case numbers. And I think that's the really clear message in all of this, that we can still control this by getting vaccinated, wearing masks, and getting tested when we have symptoms.
Minister, do you support the mandatory vaccinations for SES volunteers?
we haven't mandated for them at this stage. We've put in place a whole lot of mandatory vaccination. We think it's the right thing for the people that we put it in place for, such as our health workers and police, correctional services, of course, and also now with our teachers before they go back to the school year. We stand by our mandatory vaccinations, including for all of those businesses that will be required to have their staff and patrons vaccinated to trade from next Friday, the 17th. My question is why so many LNP members, and I'll say at state and federal level, will not commit to this and in fact have openly opposed mandatory vaccination, when the only reason we're standing here saying that we've reached 80% double dose already is because those measures have helped push the vaccination rate up. There was two ways to push the vaccination rate up: mandating or having a major outbreak. We've done it without a major outbreak, without significant loss of life, and without thousands and thousands of cases. So that's a pretty good outcome, and I would have thought both federal members and state members, including the Leader of the Opposition, would be backing this in, because it has helped us get to 80%, and now we need to get to 90% and beyond.
Would you support a move though to vaccinate essential workers?
Look, we'll take that on advice, but at this stage we believe that the measures we've put in place and what we've announced for mandatory vaccination is sufficient to keep the community safe in the most high-risk settings and also to look after the most vulnerable.
Mr. Hinsmith, have you read the whole CCC report?
Yes, I have.
What's your take on it?
Look, my take on it is that it's very interesting. It certainly highlights a number of very important issues that need to be considered, and I look forward to considering it alongside my cabinet colleagues.
Given that Logan report, do you have any regrets about your actions at the Logan Council?
My role was to implement the law. The Local Government Act said that if a council could not form a quorum in order to pass a budget, then it was my duty to dismiss the council. The Logan City Council could not form a quorum under law at the time.
And given the report's findings and mentions of Mr. McSparrow, do you have confidence in Alan McSparrow in his current role?
As I said, I've read the report with great interest, and I look forward to discussing its contents with my colleagues.
No, but personally, do you have confidence
as I say, I look forward to discussing the contents with my colleagues.
You can't bring yourself to say I have confidence in it?
I want to reiterate how important that report is, and I have great respect for the PCCC and its role in oversighting the Crime and Corruption Commission, and I look forward to discussing with my colleagues.
Thanks, guys. Thank you.
Can we go for a swim? It's been too fun looking out there.
So grab your mask.